Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
This meeting is being recorded.
Short life can be.
Yes. He had become very low key. I mean, he wasn't in the limelight like the rest of his family.
Yeah, you're right. He wasn't. Yeah.
Mhm.
But was Yolanda very active?
I think she was. I see her date of birth or age of birth. She died young too.
Yeah.
Yeah. I think she was more active or visible than Dexter.
Mm-hmm. Yeah. This is a subject that many of you have become aware of because as you get older, you have to see the eye doctor for cataracts and other things. But glaucoma is one thing about cataracts. It's relatively easy to treat and is associated with quick recovery, whereas glaucoma, which is a condition in which the intraocular pressures are very high, and the high pressures damage the retina, and it will cause you to go blind if you're not treated. There are two types of glaucoma: the open angle glaucoma, which is the commonest, and then there's another form of it, and they are the worldwide the commonest cause of blindness in the world. And this is a disease which we do have medical treatment for it, and we also have surgical treatment for it. But the important thing is to get it diagnosed as early as possible and then get it treated to avoid going blind. One of the, when we talk about the gifts to the world, that gifts to us, sight is one of the many precious gifts that we have. And so to try to stay healthy, and they recommend going to your eye doctor every other year. So to get to see if you develop glaucoma or cataracts or any of those other things. Most of us will develop cataracts and need to have cataract surgery, but glaucoma is the other thing that we seem to be predisposed to. Any of you have glaucoma?
I don't have glaucoma, but I am at risk for glaucoma, so therefore I take drops every day.
Okay, I have glaucoma. My mother had glaucoma also. And I had, I think it's laser surgery. One doctor I happened to see, and he said, why don't you do this? And it did relieve the pressure on my eye. And it's been very good since the surgery. So I don't take drops or anything.
Oh, wonderful. That's good.
Mm-hmm.
May I share? May I share something?
Yes, sure.
I've been recently diagnosed with something called floaters.
Yeah.
And it's like, what is that? So anyway, and then I was told to take dry eye over the counter. Floaters things is like something flying in my.
Yeah. Have you had any?
And I'm trying to catch it and can't catch it.
Have you had any surgery, eye surgery at all?
I've not had eye surgery. This was a recent diagnosis. So they suggested that I use the dry eye and something called cystine over the counter, and then to increase my vitamin A intake and to see, what happens. And the other thing I noticed that I experienced at nighttime, a car coming towards me, the headlights are just so bright and just unbelievable. I almost have to look away from that. So those are the things for me for the first time that I'm experiencing regarding the eye vision.
Yeah, floaters are something that some people get after surgery and some people just develop, but they're supposed to be. People say that they're inconsequential, but that's probably those people who don't have floaters. If you have floaters, it can be very distracting. But in terms of the treatment for it, I don't know too much about it, and I'll see if we can get one of our eye specialists to come and talk to us about glaucoma and cataracts and the other eye conditions to try and get an answer to some of your questions. For dry eye, it's a relatively common condition that develops later on in life, in which the secretions that keep your eyes moist decrease, and in order to keep your eyes moist, you have to use drops. And with the drops, it protects the eyes. But in terms of the best treatment for floaters, I'm not sure about that. So I'm going to see if we can get one of the eye doctors to talk with us.
Thank you.
I was diagnosed with it about 5 years ago. And as she stated, very distracting. You want to catch it, and went to the doctor about it. And he said, "Oh, it's not serious. Don't worry about it." And he said something about the dry eyes and to use the liquid, but it went away. So I don't know if it's totally gone or am I just used to it. But initially, it was a big deal, very distracting. But now it's gone. So there's no problems with it now at all.
Thank you.
So I don't know if that's normally the case or does it get progressively worse? I don't know, but now it's not an issue.
Thank you, Jesus. Thank you.
Well,
Testimony.
well, let's hope that Dr. Duncan, that's your experience as well.
Amen.
I had a similar situation with the floaters, very annoying, very distracting, and I have a exam every year because I'm a scuba diver, so I have to have a physical. And my ophthalmologist told me that those floaters are very common as you age, not really very serious, very annoying, but not a very serious symptom, and it doesn't really indicate anything else is wrong. I also have dry eye, and I use these refresh tears at least twice a day, and that seems to help.
Thank you.
You're quite welcome.
Okay. Any other comments? If not, this is a subject that I thought this group would be interested in because we have so many educators. And we've talked about this for some time, about the fact that mobile phones and tablets are in the classroom. Actually, and they're outside of the classroom as well. And the question is how much distraction is that? Actually, I teach in medical school. And one of the things I notice is that as I look around the room, and they have people who are looking at all kinds of things on the screen other than the lecture that's going on. And so for that reason, many places, as you see, as you go down, they have actually banned the use of phones and devices, smartphones in the classroom. What is your experience, many of you educators out there, in terms of allowing cell phones to be used in the classroom.
That's one of the reasons I retired when I did. At the high school where I taught, cell phones were banned, and especially the young ladies would bring them in their underwear. So even though they were searched, uh, some of the places that they were able to store these phones, and it got really bad as far as distraction. You'd be teaching and you hear a phone ringing, and I remember one young lady said, "Oh, I'm sorry, I got to go out in the hall. My mother's calling me." And this is during a lesson. It's the other thing. And I mentioned this before. I give a biology test, period 1, and by period 4 biology class,
Right.
they would have all the answers, all the questions. They would send them over to the other class. So I had to make different tests for each class, each biology.
They're smart. They are smart.
The worst thing though was the boys that had them would try to take pictures under the table of the girls. So so I was glad when they banned them, but they weren't very effective in getting rid of. I mean, because the kids are very creative.
I had almost the same similar things happen. And one time, one girl called, and I didn't know it, had called her mother and aunt to beat some child up in the classroom. And they stood outside the classroom and asked them to come out so they could beat them up. But
Really?
yeah. But the thing about it is we started having workshops during our staff development, how to implement the cell phone into your lesson and use it so to help you teach a lesson or get the information, because the schools decided they just couldn't beat the cell phones. Some teachers would say put them in the front of the class or put them in this lockbox, and at the end of the class you can get it. But it really presents a problem all the way through. There's no way of really defeating the cell phones.
Good morning, everyone. I was glad that they banned cell phone because some of the students were using it as a bully technique against other kids.
Yeah.
But in high school, it was just ridiculous. Elementary and almost middle school, you can almost have control. Now with technology, they no longer have textbooks. They have to use their iPads or cell phones for the lessons. So I'm glad I retired in time.
There was something on
in this article, they talk about it being an addiction. It's interesting that they would say that because adults are probably more addicted than children.
True that.
Any more comments about this subject?
The only way you can beat that game is to make sure your lesson and your assignments are all digital. Even if you have stuff up on the board, homework, classwork, everything, require the students to answer questions and everything on their cell phones. Keep them occupied with the academics on their devices. That's the only solution, I think.
Kids are using cell phones at 3 and 4 years old. All right, they know how to scroll. They know how to maneuver on a cell phone better than we do. at 3 and 4 years old. It's unbelievable.
Yes.
Well, it's something that's with us, and it's controlling us rather than we controlling it. This is another article that talks about a subject we've had many articles on, and the impact of early life adversity on a child's brain development, and how this can result in long-term modified the brain development, and also be the cause of chronic disease thereafter. And so it's not inconsequential that our children of color in the District of Columbia are associated with so many violent circumstances that later on they have mental health problems as well as cardiovascular problems. But what this article is emphasizing is that it also interferes with the pace of brain development. And it seems as though this is one of the reasons that we don't do so well on some examinations. What has been your experience as teachers being associated with children who are impacted daily with the consequences of violence, gun violence and other kind of violence and bullying and those kinds of things? What has been your experience as teachers?
Well, one thing we know that some kids skip school because they're being bullied. And that's no good. They have to go to another school sometimes, and that's no good.
When students have trauma, teachers really don't know why they're acting out. And you really don't have time to have it diagnosed why they're acting out. And this information is good, but how does it help you in the classroom? Or they got to spend time out of the classroom to go to a school counselor who most of the time is not prepared to deal with the situation nor the time, because they got to spend that time in the classroom. And like I told you the story before, when my daughter was teaching at Ballou, and a child was killed at the bus stop, and the kids came to school that day with the blood stains still on their clothing from the person being shot. There is trauma, and they might send a counselor or two in the classroom, but they need long-term counseling. And I know my husband was teaching at another school, and the boy started fighting all the time, and he kept saying the kids were joning on him, and he kept saying, "My mother is dead," and they didn't have any records. So when he and the principal went to visit the home, the mother had been dead, and the boy was coming to school. That's trauma. Yes, that's trauma. But what did our society or the school do for that child after they discovered that and he had no relatives here? That's a long-term trauma that, this information is good, but do we have enough work for these workers to actually help these kids long-term? And it's just not one session. This is months and years that they need therapy.
Well spoken. Any other comments?
I'm of the same mind as far as the help that these kids need, especially in DC. It's almost every day when you hear of a shooting, and the fear that goes along with that, the paranoia, even the violence that they see. One of my students was in class acting out one day on a Thursday, and that night he was out on the street and got killed. And I mean, the number of funerals that these kids are going to nowadays, I mean, it's kind of you know they want to numb themselves to that feeling of grief. I don't even know if they really know how to grieve because it happens so often. I think it's a lot of fear involved, and the reaction to that fear can be also bad behavior on the kid's part, on the student's part.
Good morning, everyone.
Hi, Betty.
I am listening to what you all are saying about children, but my experience was an adult experience in the workplace. And I'm thinking that back in the day, they didn't have counselors and this type of thing, but we had a shooting in the workplace. And when we were questioned uh, by the authorities, it was found out that because of, at that time, it was called joning, because of the different guys joning on this other guy, he brought a gun to work and killed an employee and injured maybe three others. So if it traumatizes an adult, you can imagine what it does for a child.
Painful subject. It involves us so much, and it involves our children's welfare and their health forever after, as well as the fact that it stunts their brain development. So it's a concern that we have, and this next paper kind of points out the fact that the cardiovascular disease in adulthood is related to the childhood stress, and these kids that grow up in DC are ever stressed, and when you talk about grit, uh, kids who grow up in DC and places, in Chicago and other places like that, they really have much to overcome, and it plays out in their uh, cardiovascular diseases, whether it's high blood pressure or stroke or heart disease. It's the price that we pay, and we see our younger people having heart attacks and those kinds of things. And much of it is related to the fact that they had stress that is unresolved from childhood. And one of the things is that you often pay the price early on in life, but sometimes you do. But you pay a price later on in life if you don't pay for it early. And what plagues us, of course, are these same cardiovascular diseases throughout our lifetime. So, what do you teachers have to say about this as well? Any comments? One of the things that people don't realize is that hypertension begins sometimes earlier than the age of 12. And so one of the ways of following this is to have the kids to have their blood pressure checked, because you find far too many of them that have elevated blood pressures.
Dr. Callender, that brings up a question. How often do kids actually get their blood pressure checked?
Very infrequently. Very infrequently. And it's something that I've been talking about in my talks across the country, that especially in people of color, hypertension begins at an age of 12 or earlier. And so we need to have our children's blood pressure checked after the age of 12 to see if they have hypertension. And that's why it's so important to have these blood pressure monitors at home. So,
Dr. Callender, in schools, I don't think teachers think about future cardiovascular diseases and high blood pressure because they're so busy teaching their subject areas. However, I think they rely on the nurse in the building to take care of all that. They have regular dental checkups for students. Like they'll have a dentist come in. Um, they have other professionals, healthcare professionals come in and check different things. So, in addition to that, I think maybe to the point of this article, the nurse or some other healthcare professional needs to come in and do what is called a screening, just a spot check of the children's blood pressure and other health issues because the teacher can't do it.
Yeah, I think that really the place it probably is best done is at the children's homes, and their parents uh, would be the best place for it to start, with them having blood pressure monitors. The nurses in the schools are not really screening people for any of this. They are treating people for whatever they have, but the screening of it is not done at all. They deal with problems and symptoms, but they don't do anything screening to find out if people have hypertension or not. They take care of them if they have issues.
Dr. Callender, I was just thinking about that. Some of these schools have 800, 900, 1,000 kids. Can you imagine having to do blood pressure checks on 1,000 kids?
Yeah.
That would take
I
up
can
a lot of
imagine.
time.
Yeah. That's why the real solution, as we're finding out in taking care of patients, patient-centered care is the essence. So that means that the patient is involved in the treatment and is the main factors. Similarly, with the children, the parents need to be the focal point. Of course, as we know, sometimes the irresponsibility begins at the parents. Any other comments on this?
Yes. Again, good morning. Dr. Callender, long time ago, I remember when some medical staff would come in and do like free screening, free dental screening. I can't remember what state that was when I was living in, but I remember a time, but then all of a sudden that disappeared. But the other comment that I had was going back to the paragraph at the top, all the warning signs. It says research observed the individual who experienced greater levels of stress from their teenage years into adulthood were most likely to have worse vascular health, higher total body fat, more fat around the belly. Because one of the things when you get into any exercise program, the first thing they have you do is to, in addition to the other thing, is to measure your waistline, because they were saying that you should have a certain waistline,
Yeah, waist circumference is one of the ways to address some of the aspects of ill health. And of course, we're having so much obesity, teenage and obesity, that this is also an important screen. But for the most part, we're doing no screening of the youngsters, and that's a concern.
Oh, one little small thing. Something. Well, I'd say something funny happened in my classroom was that we had a situation where the kids had to eat in the classroom one day, and so this little boy went to his locker and he, we put paper down on the desk and he proceeded to eat his lunch, and he pulled out a bag of potato chips. And I asked him, was he going to share that with all of us in the classroom? And he says, no, he was going to eat it himself. I said, well, okay, come up to my desk because we need a conference. And so he came up to my desk and we had a private conference. And I had him to read what the bag said. And the bag said family size.
What? It said what?
It said family size bag.
Wow.
Potato chips for family size. It wasn't for individual size. So he said, oh, he never noticed it before. He said, oh, Ms. Dorsch, because that was the day that you could teach science and incorporate food in it. You know, you could teach reading and incorporate health in it. I mean, you could do a collaboration of teaching. And that's the way I taught. You know, if I taught a story in literature that talks about the flood, the flood that with Noah, that means that when I go to science, I'm going to talk about the power of the flow of water. So that's that's the way I taught. And so it was easy to have that conference with him. And so he just laughed. He said, okay, Miss George.
Yeah, it's interesting that his lunch would be potato chips, which is totally unhealthy anyway. But any other comments about that?
There's 5 things I think in our society that we've taken away to enhance our life. One was recess in elementary school and even middle school. And without that exercise, physical exercise, there's no way to get rid of the stress. We stopped children from walking to school and start busing them to school, which also eliminated excess. We took away recess because we wanted to build them up as far as teachers' jobs were on the line if their reading scores and math scores didn't go up. So we decided more time for educational, which really it went down because the kids didn't have the exercise. We introduced fast foods, which starts that, and the children can't run. They can't walk to school, so there's no exercise, and they're getting fat off of the fast foods. In our churches, there were 2 things, especially in the Protestant churches, let's say the Baptists and the Colgate classes, we took away shouting, where people were able to express the stress through just shouts and moans and etc. Testifying, where they were able to talk out their stress in church to apply it to God. So we took away that talking time, which they couldn't do in society, that shouting where they could cry and weep over the stress to release that because they couldn't always do it at home. Those 5 elements have deteriorated because no one hardly shouts anymore. They don't testify. The kids have no recess. They're not walking to school, and we're eating fast foods.
Any other comments? Okay.
I think Carol has summed it up very well.
Okay.
And that's not to be funny or anything, but I think her analogy of the situations were very well expressed.
So
Okay.
what you're saying is I can't shout at church anymore
Why not?
because they won't let you.
What church is that you go to? They don't let you shout.
The Episcopal and Presbyterian church.
Oh, really?
Well,
Well,
Dr. Callender, do they shout in Methodist churches?
yeah,
Okay.
not as much as in Pentecostal churches or Baptist churches.
Yeah, we shout our heads off, but it's not as prevalent anymore. And for people to even exercise, to get up and talk and release their emotions, we have to be very quiet and stoic about it. We get
Really? Don't you have prayer and testimony in church?
Not too often. It's usually during prayer meeting time on a weekday,
okay.
but not during Sunday morning service.
Well, yeah, that's what the Baptists do well.
And what you're describing is Catholics. We're very quiet in church.
Oh, we're very
And
quiet. Yeah.
yes, and that's how I was raised. We're all Catholics. But you know that son of mine, Mama, I don't know, it's too quiet in here. And of course, I said, you're going to come to my church until you're old enough to do something else. We'll let you make your decision later. Well, you know, his decision wasn't to remain a Catholic, which is okay. But I said, you got to go to church. And he loves church. But yes, he likes a little more excitement. He wants to hear the people talk and shout and whatever. But Catholics are very reserved in church.
Yeah. Well, Baptists are just the opposite of that.
Yeah. Mm-hmm.
Yeah. And Pentecostals are the ultimate thing.
Yeah.
Okay. That's one thing. It's good to hear so many different perspectives on all of the subjects.
Mm-hmm.
This is an article, you know, in this day and age, we talk about the reason for people being on drugs is because they put on opioids. Of course, as far as I'm concerned, that's just one of the reasons, and many reasons for the opioid epidemic. But so they talk about the things that we can do to manage pain without putting them on habit-forming drugs, because that's what opioids are. They habit-forming, and once you get started on them, for some people it's impossible for them to stop. And so this then requires alternative therapies, and this article talks about 6 therapies that can be used so that you don't have to put patients on narcotics or uh, addictive drugs. And so they talk about using medications that are not addicting. Then, of course, there's acupuncture, which is another way of managing uh, pain, blocking the neurotransmitters. And then, of course, hypnosis. Uh, then music therapy, which we've talked about before. And then, of course, the other medications. NSAIDs and acetaminophen are talked about. We know, of course, that they have side effects. Acetaminophen is noticed for liver toxicity. NSAIDs are noticed for gastritis and other problems. So that there are other medications. And then, of course, the serotonin norepinephrine inhibitors are well known for antidepressant. And then, of course, anticonvulsants for patients who have epilepsy. And so these are some of the therapies that are available to keep you from becoming addicted to medications that are addictive. And of course, codeine and morphine and Dilaudid and Demerol, all of those are the medications that are the addictive medications. Of course, nowadays, those are just the starting points. And what happens is they finally get on fentanyl and then they die. So in many ways, one of the ways to head all of this off is not to give opioids at all. And so that's why this article talks about the 6 ways in which you can avoid giving addictive opioids. Any comments about this? Because I think our children and grandchildren is important to protect them. And if you,
Dr. Callender, one time you mentioned that we shouldn't really have to suffer with, if you have pain, you really shouldn't have to suffer and have pain. Right?
I agree. And
okay,
so,
well then they were saying, well, for childbirth, I know when I was first pregnant and I wanted to have, natural childbirth. And the doctor said, why should you when they have all this medication? And there was a time in our culture where we couldn't have it at all. But then there was a report that came out that natural childbirth without any drugs for the mother was better for the child. And then they said it was better for the mother recovery. But why would a woman want to have to suffer with all of that and just have the drugs? I don't know what was the harm for the child. Your opinion on that?
Yeah, I think that my opinion is number one, if you have pain, that a short period of time for you to take pain medicine is okay. In other words, taking it for 3 days is fine. And so if I'm the doctor and you have pain, I would give you pain medicine, and I'd give you the opioids, but I'd give it for a very short period of time, no longer than 3 to 5 days. And after it stopped, whether you like it or not, it stopped. So the same thing with the pregnancy. You're right. You have ways in which the mother can feel little or no pain. So why feel pain? One of the first reasons we had doctors for was to alleviate pain. But in some ways, we've gone just the opposite direction, and we have people suffering, and we won't even give them pain medicine. I'm not from that school. I think that's going backwards.
Dr. Callender, what about certain procedures where the patient has a choice? Colonoscopy, because Darryl, who's online with us, he said that all of his colonoscopies, he's going to not have the pain medication.
It's your choice. It's always your choice because everything you do, you have to give consent for. So if you want to do it without pain medicine, that's your option. I wouldn't do it without pain medicine, but those who feel that it's problematic should do it without pain medicine, but I wouldn't.
Thank you.
Janice, you had a comment? No?
No.
I have a comment. I saw hypnosis on there. Is hypnosis
Yes.
widely used?
No, psychiatrists often use it, but I don't know anybody else who uses it. Just like acupuncture, you have specialists who use it. So then most of the hypnotic users are the psychiatrists, and as far as I know, they're the psychiatrists or psychologists as well.
I was just smiling because way back when, with David's many ailments, as Carol said, Dr. Callender, you said no one should be in pain. Go to your doctor, talk about it, and get relief. You just don't walk around in pain. And I remembered that, and he remembered it. And I have a sister now who's having some issues, and oh, girl, I heard every day, why? Go see a doctor and you can get relief. Not necessarily because of a pill, pain, but sometimes it's just a matter of therapy. Don't be in pain. Dr. Callender said no one should be in pain. So I say that a lot because you've told it to us many times, but it's different forms of being relieved from pain. Sometimes it's a pill, but sometimes it's other methods.
Couldn't agree more. Any other comments on the subject?
But
Because
there's
I've seen many of patients who, when they go to the doctor refused to give them pain medicine primarily because of this reason. And I think that's something that is going the wrong way. Now, if you have a chronic pain condition, that's another story because some people have sickle cell disease. And that's a disease in which you have to take pain medicine, else you won't be able to survive. And so there's certain chronic pain conditions that require that you get opioids and other pain medication, and then therefore you have to endure it. But having pain every day of your life is not something that. That's why we have doctors. Theoretically,
Yeah,
that's why.
exactly. Yeah. Hmm.
And I'm glad you had more than one type of pain medicine. I'm not going to mention the name, but there was one pain medication that John was on, and it was a hallucinant pain medicine, but they didn't tell us that. And he showed some signs, and so then I said, "Oh, I'm allergic to that pain medicine," because I didn't want him taking that because of the side effects. But they don't always tell you the side effects of all this pain medication.
Well, they don't know them because uh, everybody doesn't have the same side effects. And so,
Okay.
if you have side effects, you should be sure to tell your doctor. And that's why I've always encouraged to have this spouse be present so you can know what else is going on, because one side of the story is not the whole story. And I think that's crucial that you recognize that and protected your husband as a consequence.
Dr. Callender, do you know that sometimes, well, pain, uh, there's probably somewhere in your brain that lets you know when you're having pain and when you're not. But I perceive that some of it is psychosomatic because one time I was in a hospital and they gave me some kind of a drip. You push a button and you get a dose of pain medicine. Well, I come to find out that there was nothing in there, and I was just clicking the button and nothing was coming out, and the pain went away.
Mental.
Well, I think you're right. There's an element of pain that is psychosomatic, and that's why in many of the studies they have an arm in which they give you the medicine and an arm in which they don't give you the medicine, because there's an element of pain that has to do with the psyche. And you're right, there's a pain center in the brain. So, and as you talk about uh, pain medication, there are ways to uh, reduce pain, which does not require medication. So it's a complicated aspect that one size does not fit all.
Yeah, I come to think about it, that was a morphine drip that they were giving me.
Mhm. Okay. Uh, uh, I didn't hear anybody talk about the music therapy, but that's another form of therapy that many of you are associated with. Um, this is an interesting article because some people like sushi and other raw meats, and uh, is that something that's we should be doing? That's the source of this article, and um, there are those who think that cooking meat only makes it worse, not recognizing that one of the reasons we uh, cook foods and meats and other things is to reduce the bacterial content and to prevent infection. And those who do not cook their foods and eat it raw have an increased risk of being associated with infections that sometimes can be lethal. So anyway, this article talks about the foodborne illnesses, which are many, which is one of the reasons why we boil our food and we cook our food so much. Uh, and we know that sometimes the heating and the boiling and all of that can remove some of the important nutrients. But the question is, what do you want to have, the risk of foodborne illness or uh, boiled heated foods. And so the question, that's why this article is done. So this says there are no known health benefits of eating raw meat. None that I know of, but there's still people who still think it's okay. So, any of you like raw meat?
I had a question, Doc, about you mentioned sushi. Do they consider that as raw meat?
It's raw fish, but it's raw fish. What is it? There's oysters as well, and all of those have associated with some degree of infection, but if they're handled correctly, more often than not, people eat sushi safely. But whenever you eat raw fish, it has its risks as well.
Okay.
And there are. I mean, you see many sushi stores in which many people eat sushi and oysters and other things, and they don't experience any harm. But there are those who do experience.
I'm one of those people, and I've never had an illness, but I think we had an article a couple months back about in California, people ate raw seafood and died from it.
Right. Yeah.
The other thing we learned on group session is that sometimes it's in the food handling that you get these infections. The people
It's
who are
often,
yeah,
it's often in the food handlers. Yeah, you're right about that. Especially if you would watch the food handlers and how clean they are or unclean they are, it would give you a reason to stay at home and eat your food at home. The bottom line of that article was that it's safer especially with meat, to cook your food. It's safer that way. This is an interesting article because we've seen so many articles about multivitamin supplements that they aren't necessary and that they do little good except fill the pockets of the people who make the drugs. This is the third study, however, it shows that multivitamin supplements improve memory and slow the cognitive aging in older adults. So I wanted you guys to see this one because for older people, it appears that there are advantages to multivitamin supplements. And so maybe for younger people, it may not be as advantageous. Once again, this does not apply if you have a vitamin deficiency, because some people have vitamin deficiencies. If you have vitamin deficiency, you must take a vitamin supplement. But for those who don't have vitamin deficiencies, then taking vitamin supplements may not be as advantaged for you as it is for older adults. And that's what this article talks about. That they've done 3 major studies that have demonstrated that these multivitamin supplements improve the memory and slow down cognitive decline. Any comments? Any of you folks have any experience with any of this?
Dr. Callender, before we had an article that said that multivitamins really didn't do anything. Now we
Correct.
got a study that says that multivitamins help us when we're older. And they say 3 studies. What does 3 studies mean? three
Well,
separate
they
studies.
mentioned the three major studies, not just three studies, but three studies in which they have a significant number of people involved. And so when they say that, they talking about large scale nationwide studies that give credence to the fact that these multivitamins are of benefit. Most of the other studies were done on general population and not on specifically older adults. So so that's the difference.
So we're to believe this one and not the old one.
No, we're to recognize that we have three major studies that have been done on older people that demonstrate that there's a benefit. That's all I can say. The other studies were not that specific. So I would not put them in the same category because there's general studies that didn't look particularly. For example, they looked at this 5,000 people in this study. Some of the other studies weren't on that order of magnitude. And in addition, they didn't deal only with older adults. So this study makes one believe that for older adults, it may be appropriate. But of course, this is not the end of it. There'll be more and more studies. And one of the other questions you may ask about these studies is what percentage of the studies that are what percent of the population that is studied are people of color? And I don't know the answer to that question because in this article it doesn't answer that question. Any other comments on the vitamin issue? Because Carol has stated it quite correctly that that many other studies showed that it was good for the pockets of the drug makers, but for a few others.
I'm glad I didn't throw mine away. Yeah,
It was also mentioned that the store brand was just as good as the other expensive multivitamin brands, I think.
Right. Yeah, okay. Well, I'm not aware of the cost, so I don't know.
and now they have one a day for over 50, and now they have one a day for over 65. That's
Yeah.
what and
My
I
only comment
definitely
is
need
that, oh,
I need iron, so I have to take iron for my hemoglobin is low
Right,
otherwise.
and iron is not really a vitamin. That's an element that is important for hemoglobin.
yes, Callender. Vitamins, minerals, and nutrients. That's how I look at it, and I take those, um, and I know what it does for my body. And I also work with my 97-year-old mom. So, but what I tell everyone is that do your research. Go online and see what's in it.
I want to
And
ask.
Sylvia, did you find that Vitron C?
That's what I take. That's what I take.
Sylvia, you're muted.
I didn't believe in it, and later in life, I started taking Citrical, and then I was doing Citrical D. I always had a problem with low vitamin D levels, and especially during the start of COVID, they said track your vitamin D. You know, you have to have your vitamin D level up, and mine stayed low most of my life, generally around 25, and the average range, I think, Dr. Callender, is 30 to 100. And so, in addition to the Citrical D, I take a vitamin D supplement, 1,000 units. my vitamin D level is now finally at the 30 mark, which isn't high, but my doctor's very pleased. It's come up. As a matter of fact, my last blood test, I was at 33. So it doesn't sound unusually high, but it's high for me. And I think that the supplement has helped. Of course, you can eat. You know, if you are a healthy eater, I think that contributes to our vitamin levels. But in my case, I think that extra vitamin D each day, it helped.
Well, thank you. Any other comments? If not, let's move to the next one.
I heard Elizabeth say do research, but you have to have some type of knowledge to know what you're going to and look at the labels. I have no clue unless I got a guide of what I'm looking for. I could look on the back of these bottles. I did have chemistry a little bit, but anyway, there should be a guide or something to tell us what we should have, because when I look at these vitamins, they say, oh, you need this, this, and that, but I have no idea what I really need.
Well, that's why, when you go to your doctor, they do vitamin levels. So they can tell you what your vitamin level is, because they're B, C, D, E, A. So there are tests that the doctors can do to tell you what your vitamin level is. So it's not a mystery. And you can include your doctor and let him know that you would like to have your blood tested for the vitamin levels, and they can do that for you.
Yes, I love that, Dr. Callender, because I know with my body and with the medicine, the one medicine that I'm on, my body needs 1,000 milligrams of calcium, D3, every day. And my body, and if I don't take it, my body talks to me.
Well, that's important to know that. That's important to know what your body needs. That's important. Yeah.
Dr. Callender, I was once told that I should take a probiotic. What's that? You go to the store and say, okay, I'm going to buy a probiotic. There's 1,000 of them. What is a probiotic?
Well, we've had this discussion many times, but probiotic is just the good bacteria in your gastrointestinal tract that promote health. And you're right. You can find a number of probiotics, but they allegedly support your digestive processes, and they knock out the bad bacteria and promote the long life of the good bacteria, which are healthy for you. So the bottom line is, I take probiotic, but I don't think you must take it. But if you want to take it, you can. And one of the interesting examples of that is the fecal transplant. And what they do is to take the feces of a person who has overcome these infections, and they give that to you because it has the good bacteria in it, and that cures people who have diarrhea and other kinds of problems. So there's some evidence that the good bacteria are of some benefit in some instances. So I'm a proponent of it, but I wouldn't. It's something that may be good for you, and the data is inconclusive. There's data that says yes, and there's data that says maybe, and there's data that says no. So that's why. That's my answer to your question. Yeah, I think it's okay. It's okay. I do it. I take it. But when you look at all the research on it, it's up to you, because there's data that says yes, it's great and wonderful. Data says it's of no value, and there's data that says it's not too much data will say that it's harmful. And the only question is whether it is a benefit or not.
And
But it is giving you the good bacteria that knocks out the bad bacteria.
Dr. Callender, I notice now that the commercials are coming out, but pre, pro, and postbiotic.
Yeah, well, I hadn't noticed that, but anyway.
I have a question for you, Doc. So yeah, I take probiotics as well. How do
Dr.
you get? How do
Dr.
you get?
Duncan, good luck on your yoga class.
Okay,
John Buchanan would be thrilled to know that you're taking your yoga.
absolutely, absolutely.
Go ahead, John. Go ahead.
How do you get a fecal? A fecal transplant. How do you get it?
Well, that's just for people who have severe diarrhea and have severe GI problems. And you'd only get it if you had those severe diarrheal problems, which do not respond to traditional medications. And in those situations, you'd have to get your doctor to get it for you.
I'm just
And
saying.
what they do is
We had a marker on that.
they take the feces and put it in a pill form, and
Okay.
and the pill form is what you take. You don't. Now in the old days they didn't do it quite that way, but nowadays they do it in a pill form. So you take a pill.
Okay.
Yeah,
I think that's better. I like that.
yeah, that's what they have now. That's it. And then the field is advanced to the extent that pills are now available, but you'd have to uh, get it from your doctor because it is a new therapy that has been proven effective.
Oh yeah, I was getting ready to say that too. That's one of the probiotics that has been proven to work.
Right. Yeah. Okay, this next article is something that is scary because most people don't realize that every day blood transfusions are given to save people's lives. And in the lingering blood shortage that we have, people's lives will be lost because of we have trauma every day. We have auto accidents, you have violence, and most of those people would die if they didn't get blood transfusions. And some of them require massive blood transfusions to save their lives. So this shortage of blood is something that is very scary to health providers, particularly surgeons. Any comments, John, or anyone else that wants to shoot?
Yeah, I've been doing it for probably like 30 years almost now. It's a really good feeling to to donate. You know that you're helping people. I wasn't aware that there's a big shortage, but I get a call every 2 months from the NIH Department of Transfusion Medicine requesting a donation, and there's a line, to donate. Every time I go in, there's at least another person or two who's donating at the same time. Also, the apheresis where they take your platelets. They do that. You get to watch a movie, a pretty new movie like of your choice, while they take the blood out, take the platelets out, and take it back into your body. And actually, some of the like the Red Cross and some other places actually pay. Even at the NIH, if you donate for research, you can get paid $50 to donate.
Right, and especially if you give blood products like platelets or other things. So yeah,
So I encourage it. And part of the issue with blood donation is RH type and ABO type. Um, you know, everybody can't donate to everybody else. You have to have a matching blood type. Um, but
unless you're
yeah, that's why
who's
they
a
bought me.
universal donor.
That's why they tell me I'm O positive.
That's what makes you so special.
Thank
Because
you
you're a
very much.
universal donor.
Yes.
Yeah. Other things make him special too. But
Well, yeah, we know that he's a genius. So
yeah.
the
The other thing,
legendary John Buchanan, right?
yeah. The question I have about the pay part, I'm thinking about prisoners and indigent citizens. People on the street. Would this be a way that they can make a little extra pocket change?
Not for blood transfusion, but for platelet transfusions. And they'd have to go through a rigorous testing to be sure that they're healthy.
Mhm.
But that would be for the um, uh, platelets and other aspects of blood, but not. There's no payment for blood donors like John, but for the other parts of blood, there is payment.
Dr. Callender, what is PRP?
PR plate. You talking about platelet?
Yeah.
Yeah, yeah. Well,
Yeah.
that's what there's been some evidence. It's not overwhelming, but some evidence that platelet-rich plasma uh, will help heal some of the orthopedic problems that people have, and especially the knee joints. And so people have had platelet-rich uh, transfusions to get healing. Sometimes it works, sometimes it doesn't. So anyway, that's what PRP is.
Oh yeah, because I had a talk with Sylvia about her son who had surgery around his shoulders and whether PRP would have helped his situation as far as healing.
Yeah, yeah. There's some data that suggests that it promotes healing of joints, and so for the knees and other joints, PRP is sometimes done. And there's some articles that think it's the greatest thing in the world, and some articles that think it's not.
Mhm.
Okay, the next one, please. Now, this is something that you may not appreciate, but before every hospitalization, before every surgery, your insurance company has to approve uh, before you can be admitted to the hospital, before you can have an operation. And sometimes it takes time. Sometimes it takes longer than 72 hours. And if you need surgery, uh, that's a problem. And it's been a problem for patients as well as physicians. And so there's been a battle to try to speed up this process so that patients can be approved for hospitalization and for surgery. And so finally, what has happened is CMS, the Medicare and Medicaid Services, Center for Medicare and Medicaid Services, has now got into the equation and insisted that they shorten the period for which you have to wait for prior authorizations. And for every hospital admission, unless it's an emergency, you have to have prior authorization. Now, for elective admissions, every single one of those has to have prior authorization. Sometimes this causes a significant delay in the treatment of patients. And so this is why this rule is good for patients as well as physicians. And hopefully from now on, that will be less of a problem. Anybody understand or not understand what I was just talking about? So that means everybody understood what I was talking about. Okay, all right,
My
good.
daughter had a question for you, Dr. Callender. She's still working to get the pancreas transplant. And she wanted to know if you've ever heard of a center um, asking her to get her own blood, take it to a lab um, to check the blood out, see, and then mail the blood back to the center on her own. Have you ever heard of that?
No.
The tissue typing. In other words, she's supposed to do her own tissue typing in a local lab and then mail the results back to the.
Well, now I've heard of that if you are distant. Now, for example, if you're not in the same city.
Right.
Well, so if it's a distant location.
Yes, it is.
Oh, well, yeah. That's commonly done if you're in a distant location. Otherwise, you'd have to go there to get it done. So if you're many miles away, like your center is in Iowa and you're in DC, rather than having you travel to Iowa, they would have you go because there are many transplant centers around, so you could have it done that way. Yeah, if for distant centers, that is common.
Okay, and so the patient pays the expense of all that?
Yeah, often your insurance company will pay it.
Okay.
Usually, it's your insurance company will pay it. But when you're at a distant center, that's one of the ways they have of decreasing the cost for you to actually travel to that center to get it done. So, but she's at Georgetown Center, right? So they could probably help her with that.
Right, and you picked the right state. It was Iowa where her center is.
Oh, isn't that interesting?
Yeah, I guess you remember. You got a good.
No, I know it's just far away. I just.
Yeah, but anyway, she's gonna take her blood and go to LabCorp and have them do the tissue typing.
Well, actually, LabCorp does tissue. I never heard of LabCorp doing tissue typing.
Maybe
usually
Georgetown.
you have special tissue type laboratories that do tissue typing.
Yeah, and so maybe Georgetown can take care of that, but she has to pay the expense to get that done and mail it back. So I'm going to talk to her about.
Well, yeah, insurance pays for that usually.
Okay, thank you.
So she's on the list at Iowa as well, is that right?
Yeah, she's on the list at Iowa, right? Because she's in the service.
Right. Okay. All right. Okay. Wow. Why is kidney disease so often missed? I guess this is a subject that is something that I've been talking about forever, I guess, because I think it's absolutely almost short of malpractice if you're over 50 and you're a person of color and they don't do urine protein screening. Because we have, after the age of 50, we have more hypertension, more diabetes, and more kidney disease than anybody else. And so if you don't do a urine screen, see, the earliest sign of kidney disease is having protein in the urine. And so one of the things that, in my opinion, you must do is to check your urine protein. And of course, if you have no protein in the urine, then of course your BUN and creatinine are of merit. But I think those three things are mandatory for anybody who's over 40. And if you don't have that done, they say 50 to 75. But most people who are older than 50 who go to their doctor don't always get protein urine protein analysis, and that to me is absolutely critical for people of color. And so if you're not getting that done, insist to your doctor that it be done, as well as a BUN and a creatinine. But you can be spilling protein in the urine and have a normal BUN creatinine. And this is one of the first signs that you need to be followed and to be sure that you don't develop kidney disease thereafter. That can be prevented if diagnosed early. And so in the early stages, you have no symptoms. And actually, there's 5 stages of kidney disease. And the first 3 stages, there are no symptoms at all. And so, to me, it's absolutely critical that you insist that your doctor get a test your urine for protein every time you get your annual physical. And that's one of the things that I think is important, because we have so much diabetes, hypertension, and kidney disease. Any comments or difference of opinion about that? Okay, we've talked about xenograft, which is transplant between members of different species. And as you know, we've had a couple of xenotransplants. Happy to hear that, Sylvia. And the xenotransplants, so far, the heart transplants from pigs have not been successful. However, whether this will work for kidney transplants remains to be seen. Now, what are the concerns? Well, one of the concerns is that, number one, there's an organ donor shortage. 17 people die every single day because of the shortage of donors. And so we don't have enough kidneys to pass around. And for that reason, xenotransplants may be the reason why we can decrease the number of people who die every day because of the shortage of donors. One of the things that we can do more is to have more live donor transplants. Every year we have more deceased donor transplants, but for the last 10 years, the number of live donor transplants have decreased. And so we've got a high demand and low supply. And this is the reason why xenotransplant may help us remedy that problem and decrease that number of people who die every day because of the shortage of donors. And the use of pigs and the CRISPR-Cas9 ways of eliminating the diseases that you can get from pigs will make it safer to do xenotransplants, because one of the things that stopped xenotransplant was the fact that you have AIDS, which was a disease that was transplanted from the ape to human. And so with the genetic re-engineering, we can eliminate the porcine endogenous retrovirus, which is so we can eliminate that, and we can also eliminate the galactic residue that causes hyperacute rejection. So these things have made it safer to do xenotransplants, and hopefully, as we get more advanced, this will become something that is possible. The question for you is, if your life is at stake, would you accept a pig kidney or pig liver or pig heart? What is your answer?
Well, based on the evidence, the pig heart was the one that didn't work out too well.
What about for kidney? See, that for kidneys, that hasn't been done yet successfully, and it hasn't been done at all recently. So the next step is to take the steps that are necessary to see if we can get a successful kidney. We know that so far the heart has not worked. We don't know anything about the kidney yet.
And we don't know that much about the liver.
No, we don't know about the liver or the kidney.
I had a question, Doc. Is the that second heart transplant recipient, did he? I thought he was still living.
He died.
Oh, okay. I didn't know.
Yeah, he died. Yeah, he died about a month later.
Wow.
Are they still doing I guess I answer my own question. They're not still doing uh, kidney dialysis with pigs. I answered my own question. No.
Okay. All right. All right. Any other comments or questions? Very interesting. I noticed nobody really chose to answer that question that I asked them.
I thought about it.
Not ready yet. Okay. All right.
I kind
Well,
of think when you get down and you realize or think that it's getting toward the end, I think you'll reach out and do anything that you think may keep you here, even though we long to go home, but we don't long that bad.
exactly. If you're faced with the fact, okay, we've done all we can do, and we'll give you a limited amount of time, a month, a couple of weeks. However, if you get this pig heart, we can prolong your life. Yeah, you would think about it.
Yeah, especially if it's a kidney or a liver.
Yeah.
Yeah.
Mhm.
Well, time will tell.
Yeah.
Right now, we aren't ready for it, but
Yeah.
as we get better, we will be able to do that.
The family
This
has
is
to pay for it, right?
no insurance
Insurance.
covers it. Well, here's the thing: if it's experimental, then uh, it's not covered by insurance. If it's already approved, see, in all of these transplants, the heart transplants were experimental.
Mhm.
So that insurance would not cover that. Does not cover experimental procedures. But if the procedure becomes no longer experimental, like kidney and liver transplant, a human transplant, those are not experimental, so those are covered by insurance. But if you were to do a pig xenotransplant, that would be not covered by insurance.
So the family would have to make a decision whether to let
Well,
their
the family and the hospital, because the family didn't have to pay for that transplant because it's experimental, so the hospital likely would eat the cost. Now, this is an article on colonoscopy. Um, this is the test that we do to prevent people from dying from colon cancer. And one of the things that is a problem is that not as many people are having colonoscopies as they should. And so more people are dying from colon cancer. And younger people, there's an article that I hope we have time to include that talks about that. But one of the things that we have are tests that we do to try to avoid the need for colonoscopy. And if it's negative, then you don't need a colonoscopy. If it's positive, then you go in and get the colonoscopy so they can find out where the polyp is and remove it. Now, one of the things that is also important is the colonoscopy itself, and one of the things that we need to have done is to have a clean washout before the colonoscopy so they can actually do the colonoscopy successfully. And so the quality of the cleaning process becomes important. And it's important that not only that you take the solution, but you take it appropriately, and that at the end of taking all the fluid, that you have clear diarrhea stool that is about clear as water. And so best practices in bowel preparation become important. And And this kind of shows that you want to see a clear yellow urine-like color to the stool, because if you've got brown stuff, you can't see. And so if you take the fluid as is given you, then by the end of that 8 to 10 hour period, you will have clear bowel movement, which is what you need to have in order to have a successful colonoscopy. Have many of you had colonoscopies?
Oh, yeah.
Good. Okay. So, you know, one of the biggest concerns is that fluid that you have to take before the colonoscopy, and that cleans you out, and it has to really clean you out so that the doctors can go into your colon and see every aspect from the rectum all the way to the cecum.
And that's the worst part of the process. You have to take in that fluid. But for me, it's hard to keep it down. And I know one time I had to have a colonoscopy. And as you said, Dr. Callender, it has to run clear. I wasn't running clear. And every time I took the, what was it? Go Lightly, I think that was the name of it. It would make me throw up. And then I took magnesium citrate. Okay, that did the job. But now you can't find that.
Well, because magnesium citrate is a good drug, but it's for people who have kidney disease, it's problematic. And you're right, it's hard to find it now. But they have better, they don't use Go Lightly so much anymore. They have more tasty products. Not that they're tasteful, but less likely to be associated with nausea and vomiting.
Dr. Callender, those at-home tests like Colorex and all that, is that an easier process?
If it's negative, if they're negative, if they're positive, you have to have the colonoscopy anyway.
Yeah, but I'm talking about the process of, you don't have to drink that stuff and all.
No. You have to do no. They test the stool.
Right.
Right.
The last time I had a colonoscopy, which was in 22, my doctor said that he couldn't get all the way up, I guess, to the upper part, and he told me to schedule a CT colonoscopy. What exactly is that? Because I never ever did it, because I started having hip problems, and then I went through this drop foot, and I never did it. But
well, it's important to do, because if they have not gone to the cecum, then they have not completed the colonoscopy.
Yeah, that's what
he said. The CT, they give you some dye to take by mouth, and then they follow the dye by the CAT scan, and they're able to evaluate the colon that way. That's not as great as the colonoscopy, but it's a good substitute if they cannot get all the way to the cecum. The goal with the colonoscopy is to go from the rectum all the way to the right side of the colon and get up to where the appendix comes in. And you haven't done a colonoscopy until you have visualized that cecum. If they haven't visualized that, they haven't done a complete colonoscopy, and then a CT colonoscopy would be indicated.
Okay. So you're saying I should go ahead and get it done?
Yes. When was the last time you had a colonoscopy?
In 22, 2022.
Well,
and this is when he.
So you must have had polyps then.
I don't think he said I had polyps. I have to go back and look.
Well, why would he want to have another one in 2 years?
Well, this is what I'm saying. He told me to do this in 2022 after the colonoscopy. He said he didn't.
Oh, but you didn't have a no. Well, that means you didn't have a colonoscopy.
Yeah,
in other
not
words,
a
you
complete
had an
one.
attempt at a colonoscopy, but it wasn't completed. When did you have one before then?
I think 3 years before that. So it's coming up on a 5-year
So the
period.
question is that 3 years before that, did you have polyps?
I don't think I did.
You must, well, it's usually they give you 5 years, 3 to 5 years if you've had polyps.
Yeah, and that's you remember I mentioned it once before when we were talking about colonoscopy, that he, instead of doing every 5 years, he was doing every 3 years. But I don't think I had the last I had polyps one time years ago.
What about your family history? Anybody in your family have colon cancer?
No.
Hmm.
So
Well, a CT colonoscopy is pretty safe.
okay, so I guess I need to he sending me to a hospital in Virginia, and I'm not familiar with the hospital, but Northern Virginia. So that's where he practices. So I guess
Yeah, yeah. Well, it sounds reasonable. Get a CT colonoscopy since he couldn't have a
yeah.
completed colonoscopy.
Yeah.
Yeah.
All right, I guess I'll follow through.
My question is, some of that dye is bad for people who have kidney disease. Is that true?
Say again.
Some of that dye that they give you is bad for your kidney.
Oh, some of that dye, if you have kidney disease, for the CT colonoscopy, usually they use a dye that doesn't affect the kidneys, but they always do a BUN and creatinine test before that to make sure that your kidney function is normal.
Okay, thank you.
So if you've had a transplant, that would make that would make them want to be sure that, and there are steps to take, even if you had the transplant, so that they would hydrate you and make sure that the dye does not affect the kidney. Next one, I guess, will be the last one. We're up to 10:30. Yeah, this is a good one to close on because this is something that is disturbing the whole healthcare profession. The fact that we're having so many more colon cancer cases under the age of 50. This case in point is a guy who's 34 years old, who's got stage 3A colon cancer, which is advanced. And we suggest getting colonoscopy at the age of 50, but this guy's at 34. And my wife's best friend died of metastatic colon cancer at the age of 40. So there are many people who are under the age of 50 who are getting colon cancer, and they're getting it, and it's killing them. And so the question is, if you have, now this guy, his father had colon cancer. So if your family has a history of parents or grandparents dying from colon cancer, this is a reason for you to consider getting colonoscopy earlier than 50. Any comments or questions about that, particularly those who have family history of colon cancer in their family?
What are some of the symptoms?
The symptoms are blood in the stool, constipation, diarrhea, colicky abdominal pain, either constipation or diarrhea.
Black stool?
No, black stool is not. Black stool means you have blood in your upper gastrointestinal tract, not the colon. Blood means you have, if you have blood in the stool, not black, blood is the upper GI, but blood in the stool means colon until proven otherwise. But red blood usually, whereas black blood means it's upper GI bleeding. Blood means lower GI bleeding. Any comments about this? This will be the last one. we'll close with this one. So for your children and grandchildren, as they approach the age of 50, these are questions you need to share with them so they can get their colonoscopy. And remember, if the colonoscopy is not complete, that is, they haven't gotten to the cecum, the right side of the colon, then that's incomplete and it's not a colonoscopy, not a completed colonoscopy. So it's like you haven't had a colonoscopy. Now, this is a slide that just talks about the 10 cancers that are common, and of course, lung cancer, breast cancer. Although the mortality rate in breast cancer is decreasing, I've seen so many of my younger Black females who are dying of breast cancer. So, and they, of course, all of them I'm talking about are younger than 50. So it's important to continue to get those screening tests for the different cancers.
Dr. Callender, I noticed that when you get your mammogram, if they talk about the density, they're now asking you to come back in for another test.
That's good.
And then after they do those two tests, then they send you a letter saying everything is, well, before you leave, they say everything is okay. And then I noticed that I got 2 letters saying that they want me to be in a study to come back in March, and they want me to be a part of this study because they're studying people with that. Because I remember you having an article about that once before. I go back to what something John Buchanan said. In studies, I thought there was some benefits, and he says that maybe I think I heard him right, talking about there's some benefits to it, like they pay you or something to be a part of this study.
Well, I think one of the things we also discussed is that there's a scarcity of Blacks in these studies.
Right.
And we need more Black people to participate so that the information we get is not only about white people, but about people of color as well.
Right.
So, yeah.
Yeah, because I noticed breast is has the highest percentage.
Yes.
Highest number, rather, the highest number.
So it's in our best interest. Didn't say yours. It's in our best interest if you participate. But that isn't necessarily me. It's going to help you, but it will help others.
Yes, thank you.
Okay, thank you so much for participating. We've had, as always, a plethora of you getting involved in questions and comments, and it's so good. What makes this group so special is that people are not hesitant to speak their minds, pro or con, and there's no judgment. Basically, you speak your mind, express your opinion, and we move on. And I think that's what makes this group so special and so good. And thank you all for participating. See you again next week. Any closing comments?
Thank you for your wealth of knowledge, Dr. Callender.
Thank you.
Thank you.
Okay. All right.
Bye-bye, everybody.
Okay. Have a great
Be safe.
weekend. See you next
Bye-bye.
week.
Bye-bye.
Hopefully we had enough snow.
Dr. Atto,
Have a great day, everyone.
we missed you last time. And
Yes.
we talked about whether diseases start on the molecular level.
Mm-hmm. Oh, okay.
So what is your answer?
Well, from research, I would say yes. You know, some diseases start from the molecular, the genetic level, particularly all these inherited diseases, like some cancers, you know, sickle cell, they start from the molecular level.
Okay.
Yes, I can. Some other diseases like acquired diseases, you know, they come from the environment.